So antimicrobial resistance has got a big impact in Bangladesh, both individual level, also at the household level, and also in the country level also. If you start with the individual level, people have to suffer for a longer period because the infection, either it's respiratory tract infection or entering, continues for a longer period. For the family, obviously, the more expenses goes because of the buying of the medicines out of the pocket. Because Bangladesh, one of the top most country where the health expenditure from out of the pocket is over 70% compared to what WHO recommends only 20%. So they have to go on buying. And when we talk at the hospital level, because of the longer stay in the hospital, because the antimicrobials are not working, the infection doesn't control, they have to stay for a longer period in the hospital. Secondary infection occurs, as well as unfortunately the death also happens because of these issues. So it's clear that antimicrobial resistance has a big impact in all these sectors, and that's also in the economy of the country too. The EPI, that stands for Expanded Program on Immunization, which started in 1979, and by 2008, the neonatal tetanus has almost been eradicated. It's not happening now, and polio has been eradicated from 2014 onwards. So now, if we talk specifically on vaccine, how it impacts on antimicrobial resistance, the things that has been added on, especially on the respiratory infection, like the pentavalent vaccine, where Haemophilus influenzae is added, the pneumococcal conjugate vaccines, which has also been added, and it has shown that following the children's having those two bugs, infection has significantly has been reduced. And very recently, the typhoid conjugate vaccine from last October 2025, from 9 months to 15 years of age, it has also been introduced in the EPI program. And we believe that typhoid is also a very big problem here, where multi-drug resistance is very high, is going to come down. But one thing from the policy makers, because their concern is that since these existing vaccines which we are providing to this population are all being funded externally by Gavi, UNICEF, other different sources. So how long will that be continued? There has to be an issue always concerning that if we add new one, whether there will be compromise with the existing, which we cannot, by no means we can stop those vaccinations. So we have to continue. And one of the way that I believe, because our pharmaceutical sectors are really doing an excellent job, they are making a lot of generic, there are few who are working on the vaccines also. So the government should encourage them and give some special incentives who are on the vaccine production, so that they can continue making those, and we can add up new vaccines in addition to the existing ones.